So I'm originally from Memphis, Tennessee, and I always knew when I was a kid I wanted to be a doctor, especially a surgeon. I didn't really know enough about orthopedics until medical school, when I did some trauma rotations and saw these really awesome, relaxed, calm, confident people come and do these horrible trauma cases, and they were getting to use a lot of hardware and power tools and things like that. And I was an engineering student, and I liked that you could kind of understand how they were doing it or why they were doing it and the rationale behind it. And then I got to go into the operating room and see some of the cool cases that they did, and I was pretty much sold. So I got very lucky and applied to residency and got into a good program at University of Rochester. And I've been lucky ever since. So I applied for a fellowship, and I got into a really good fellowship in Pittsburgh. There's a couple of really famous people that have been there. Dr. Freddie Fu is the chairman of that department. There's Dr. James Bradley, who's the Steelers team doc. And there's a guy named Dr. Musal, who is also really a pioneer in research as well. So I got to learn from all three of them. And then Dr. Harner too. Chris Harner has been legendary in a lot of knee reconstructive surgeries and stuff. So I got exposed to, while Rochester provided me a lot of the basic info and good foundation, like they got to do some of the crazier things that I didn't get to see, and use different techniques and stuff. And I'm part of both legacies now, so I still keep in touch with them and ask them questions when I see crazy cases, and they have seen it all. So that was just a great opportunity. I feel like it's coming back home, kind of. So coming back to the South, and I really liked this group. I liked the opportunity that they had. I really liked talking to Dr. Ludwig and Kinnebrew. I feel like I have a camaraderie with them already, and they were a huge part of why we came down here. The bonus parts are that my husband's family is not too far. He has an uncle and some cousins, and my mother was happy to come down here too, so my whole family is going to be here. And it's warmer and closer to sunnier places. Those are all, kind of things that we wanted to. But I really like the community, and Houston County is growing by the minute almost here, and so it just seems like a really good opportunity to put my feet down. I loved total joints like knees and hips, but I also loved the athletes. So you could see this kid who, tore his ACL or some sort of injury, like totally, not only do you see them in a really bad part of their lives, but you get to coach them through, getting better, getting to do the surgery, then following them afterwards, then getting them back to sports. Like that's huge. Such a great, satisfying accomplishment for both, and you get to kind of go through their struggle with them. So I loved that. But then I liked it with weekend warriors, and I liked it with older people who maybe aren't like collegiate athletes or high school athletes. They could still be able to play sports and stay in their level of activity, or marathoners and things like that. So the sports medicine folks that I worked with in Rochester just seemed happy. They loved it, and I found that their patients were, it's like you grew with the patients. They stayed with you forever because they would hurt, or their friend would get hurt, and you'd be involved in their community. And so that's part of why we went into sports. They also do a lot of cool arthroscopic surgeries. So it's like almost like playing video games sometimes. You get to use these tiny scope instruments and change people's lives. It was amazing. When someone gets injured or when there's a problem, I feel like I get the chance to explain it to them, what's going on, and I tell patients that if you don't understand what I'm saying and you don't know what I'm telling you, I'm not doing my job. I say that I feel like I go through the process with them. So if we get past the preoperative things like the physical therapy, injections, anti-inflammatories, like I give them the best information I have based on what they're telling me, using the best medicine I can give them, evidence-based guidelines. And if we get to the point of surgery, at that point I'm like, listen, if I'm operating you, it's like my shoulder, it's like my knee. I feel invested in your life. I want you to do well. So I feel like every patient is different, so I like it to be specific to them. I try not to treat them all like, oh, well, you have just an ACL. I've done a lot of ACLs. You're not it says patient-specific injury. I want them to know how much I am appreciative that they give me the chance to be a part of their life, that I thank people for trusting me to do the surgeries. I feel really honored and grateful to be part of their life, you know. So I want them to know that my job is to be here for them, to make sure that they understand what they're going through, and that if there's a complication, I'm feeling it just like them, you know. Like, I'm happy to be involved in their lives, and I want them to get back to the level of activity that they were at. I'm really lucky. I have a great family. I have a wonderful, supportive husband and twin 5-year-olds that are the best joys of my life. And I get to spend time with them. They're excited to come down here too. I feel like it makes me a better doctor. I get to have the best of both worlds. I'm happy in home life, happy here, and happy in the work life. And I feel like the doctoring can come into being a mom, and the mom background can come into being a doctor. When a patient comes and sees me for the first time, I'm fairly conservative. I don't like to push anyone into surgery. I mean, if there's an urgent issue, perhaps, but in general, I'd like to be fairly laid back. I like to try to have someone exhaust all the possible options. I tell patients that sometimes I make you jump through every hoop before we get to surgery, because surgery is a big deal and anything can happen with surgery, and I take it very seriously. So if I can't avoid doing a surgery on a patient, I still think it's a success. If I can get them to get back to their activities and be healthy and happy, that's all that matters. The end result is them being functional and us being on the same page with their goals. They don't have to necessarily have surgery to get there. If we do have to do surgery, then I talk about everything as I put cards on the table. I try to say this can happen. I talk about every risk, the benefits. We talk about what to expect. And when I tell them it's a long recovery time, people feel like they understand it, and then they're in the long recovery time and they know that it's a long struggle, and I'm just hang in there with me, and we're going through this together, and the goal is for you to be where you want to be. So in general, just because you come to see a surgeon doesn't mean you need a surgery. In fact, the vast majority we treat non-operatively and conservatively. Sometimes it's good just to have an answer about what's going on, and then there are multiple ways of treating it at that point.